Evening. My name is Dr. Rob Cushman. I'm the Medical Officer of Health for the Renfrew County and District Health Unit. I have a very important message for you today. As you know, we had our first case of COVID-19, our first confirmed case, last night in Renfrew County. And the day before, we had a confirmed case of a worker who resides in Quebec from a local work site. And worse, last night there was a death in Ottawa. So it's very clear, it's abundantly clear that COVID-19 is well entrenched in Eastern Ontario and in fact is in Renfrew County. And to paraphrase my colleague from Ottawa Public Health, Vera Etches, for every one case we know about, she's asking there might be 10 or even 100 out there that we don't know about because we can't test everybody. And there are a lot of people who are asymptomatic who are transmitting the disease. So as a result, this is a war. And frankly, the foot soldiers, the army here is you, the general public, because the best way to deal with this is to reduce the spread. And there are a certain number of ways to do this. The first one is physical distancing, so-called social distancing. I'm not quite sure how social it is because we do have the internet and phone and whatnot. But anyway, you know what I mean. Someone said we should keep basically the length of a hockey stick apart, some 6 feet or 2 meters or whatever. But you understand what I mean. This is extremely important. We have to do this. You have to limit yourselves to essential shopping. You have to think about your neighbors who are needy that you may shop for. Getting grandchildren and grandparents together is not on these days. While children are relatively unaffected by this disease, they are wonderful transmitters if they were to be infected. They'd be asymptomatic, but they would transmit the disease. So the first issue here is physical distancing, and there's a lot of material out there on how to do this best. And I would refer you to that. I don't have time to talk about that now. There are plenty of references out there, and I will be dealing with it again in the next few days. The second issue is that if you feel sick, there is now a virtual assessment tool, which is available on our website and also at ontario.ca. This is very interactive, very helpful. It'll give you an idea of how at risk you might be. And if so, you come up as a risky candidate for COVID, you should phone your family doctor. And if you don't have a family doctor, I'm pleased to say that a virtual assessment center by health professionals, a 1-800 number effectively, will be launched tomorrow, very soon. And that will be available for people to phone their doctors, but also for people who don't have doctors. Very, very important. And I think the key here is we know that a lot of people have minor effects of this disease. In fact, probably 80%. 20% will have problems with this disease, and probably 5% will need very attentive and critical hospitalization in a critical care unit, for example. So what we need to do, and this is key in terms of reducing the pressure on hospitals, on emergency rooms, and in terms of reducing the transmission of disease in your doctor's office, at a clinic, or in a hospital, or in an emergency room, it's best to stay away unless you absolutely need it. If you have concerns, use that self-assessment tool. And of course, if you are very, very sick, or you know of someone who is very, very sick, there was always 911 for a very quick ambulance, for a very quick visit by our emergency medical services with their ambulances. So I'll just finish up there. There'll be more to come, but disease is now in our community. And as I said earlier, you are the foot soldiers. What you must do to protect yourself and to reduce the transmission of this disease is all important if we are to emerge victorious. Thank you.